You know, when most of us think of CVS, we picture that store on the corner, right? The one where you pick up prescriptions and snacks. But that's not the real story. The real story is that CVS is one of the biggest, most audacious gambles on the entire future of American healthcare. And today, we're going to break down that exact case study. And a gamble this big really boils down to one massive question. Is this whole thing a strategic masterpiece, a brilliant model of vertical integration, or is it a financial time bomb just ticking away under the immense weight of its own ambition? That's what we're here to figure out.
So here's our game plan. We'll start with the backstory, the case study itself. Then we'll look at how they built this healthcare fortress. After that, we have to talk about the staggering price tag. Then we'll see how they're handling the execution test right now. And finally, we'll see what the market's verdict is on all of this.
All right, part one, from retail to risk. Look, to really get what CVS is today, you have to understand the key moves that took it from a simple retailer to a high-stakes healthcare giant over the last 60 years. This whole transformation really happened in 3 giant leaps. It all started back in 1967 when they first put pharmacies in their stores. Simple enough. But then, jump forward 40 years to 2007, and they merge with Caremark, a huge pharmacy benefit manager, or PBM. That move gave them enormous power over drug pricing. And then came the real earthquake, 2018, when they bought the insurance behemoth Aetna. Each step wasn't just about getting bigger, it was about getting deeper and taking on way more risk. So that brings us to section 2 and the heart of this case study, building the healthcare fortress. This is where we get into the nitty-gritty of a business model that, at least on paper, is unlike anything else in the country. And the core concept behind this whole fortress is something called vertical integration. Now, that's a classic MBA term, but in healthcare, it means something very specific. It means one single company controls the insurer that pays for your care, the pharmacy that gives you the drugs, and even the clinic where you see the doctor. And this is exactly how they built it. It's like a 4-part lock on the system. First, you have Aetna, the health insurer. Then there's CVS Caremark, the PBM pulling the strings on which drugs get covered. Number 3 is the retail piece, the thousands of pharmacies you see everywhere. And finally, you have the actual healthcare delivery with Minute Clinics and Oak Street Health. They're touching every single part of the journey. And this quote from our source material really drives the point home. No other company in the US has all 4 of these pieces under one roof. Not Walgreens, not Amazon, not even their biggest competitor, UnitedHealth, is structured in quite the same way. It's a completely unique position to be in. So the big question is, does this model actually work? Well, let's take the blockbuster drug Humira as a proof point. Because CVS controlled the PBM, the pharmacy, and the official list of approved drugs, they were able to switch over 90% of patients to cheaper alternatives. And the result? They saved their clients nearly $1 billion. Now that is real market power, and it's something they could only do because of this integrated system. But, and this is a huge but, building a fortress like this costs an unbelievable amount of money. Which brings us to section 3. The $74 billion price tag. This is the flip side, the massive vulnerability at the very core of CVS's strategy. $74.5 billion. Let that sink in for a second. That is the mountain of long-term debt CVS took on, mostly to finance that Aetna deal. It's one of the biggest debt loads in corporate America, and it hangs over every single move the company makes like a giant anchor. A debt that big has very real consequences. For one, it basically ties their hands, making it really tough to go after another big acquisition. It also puts incredible pressure on every single division to squeeze out more profit. And frankly, it's a huge reason why investors are so skeptical, which leads to a lower stock valuation than its rivals. And look, this isn't just some theoretical risk. The pressure is already showing major cracks. The Aetna division, the crown jewel they paid so much for, had severe losses in its Medicare Advantage business. That's a critical area for growth. And that single problem cost them up to $1 billion in lost bonus payments. It just goes to show how fragile this whole thing can be. So, given this constant tension between a powerful strategy and a fragile balance sheet, how is the leadership team dealing with it? That's what we'll cover in our 4th section, the execution test. It's all about how they're trying to manage this incredibly complex machine today.
Well, all that pressure led to a change right at the top. A new CEO, David Joyner, came in late 2024 with a very clear, very direct mandate: slash $2 billion in costs, and most importantly, fix the profitability problem at Aetna. The era of building is over. The era of disciplined execution has officially begun. And you can see just how high the stakes are when you look at the competition. Compared to Walgreens, CVS has this powerful integrated model, but Walgreens has a much simpler, more focused retail business. Compared to their biggest rival, UnitedHealth, CVS has this incredible network of over 9,000 physical stores, but UHG has a much bigger market cap and a more proven platform. And then there's Amazon, which can't match CVS's clinical services, but crushes them when it comes to logistics and a seamless digital experience. So after all that, what's the bottom line? What is the market? What do investors actually think of this whole thing? Let's get to our final section, the market's verdict. This is the final scorecard on CVS's enormous bet. And really, this one slide sums up the entire case study. On one side, you have the fortress, this incredible, unmatched structure with more than 100 million patient touchpoints and control over everything. But on the other side, you have the fissure, that massive $74 billion debt, the shaky profitability in key areas, and just a huge risk that they can't execute perfectly. That is the core tension of CVS Health. And if you want to see the market's judgment in a single picture, here it is. Investors value UnitedHealth Group at more than 4 times the value of CVS. And what that tells you is pretty fascinating. The market doesn't actually hate the integrated model. In fact, it loves it. It just has way more confidence that UHG can actually pull it off. So we are left right back where we started. Is this all-in-one model from CVS the inevitable future of healthcare in America? Or is it a strategic overreach, a gamble so big and so risky that the market has already cast its vote and decided it just can't win? That's the multi-billion-dollar question that will define the next chapter for CVS Health.